When life gets unpredictable, preparation matters. In medicine, it's all about staying alert, ready for whatever comes through the door. On the road, it's no different. That's why Volvo designs vehicles to help anticipate risk, reduce harm, and protect lives. The Volvo XC90's advanced safety systems inspire confident decisions wherever the road takes you. The Volvo XC90, for life. Proud sponsor of the Pit Podcast. Learn more at volvocars.ca/safety.
I want to get to this next story. I actually heard Trudy talking about it this morning. It's a new Leger poll, which now shows that nearly 1 in 10 Canadians are taking the popular weight loss drug Ozempic. And, of course, there are derivatives as well. Wegovy is one of them, I think. Mounjaro is another. But what it also points out is, and perhaps not surprising, because we know the advertising surrounding this stuff has been pretty incredible, and bottom line is it works for many, many people. So I know Dr. Chris Labos, by the way, is on the line, cardiologist with a degree in epidemiology. He's a regular here on CJAD. You can catch him weekends with Joanne at 7:20 on Sunday morning. So, Dr. Labos, we've talked about Wegovy, we've talked about these drugs before, but with relation to this study specifically, right? We know there are generics coming in. It seems one of the issues, the number's big, right? 1 in 10 Canadians, but it's going to be bigger once the price starts coming down, and that's apparently on the way, right?
Yeah, it is, because what happens is the minute you have a generic in the market, and there are actually strict rules about this in Canada, whenever you have, 2 competitors applying for production versus 3, the price drop can be substantial. It can be as much as 2/3. So, there's some variability there, and we'll see what the final thing is. But yes, once the generics come onto the market, we could see a very, very significant price reduction. Now, initially, it's just going to be for the indication of obesity, because that's what was approved by Health Canada. But, as we saw when the medication was first developed and put onto the market, it's the same chemical that's being used for weight loss, right? So I think eventually you are going to see it formally approved for that as well. So it'll take a while, but yeah, you're going to see a very, very significant price reduction in this medication in the not too distant future.
Yeah, and of course, one of the other things is people who have been taking it, or early adopters, if you will, had to take it by injection. Now we have pills that are going to be doing the same thing. That would make it more accessible, I guess, to many more Canadians.
Yeah, it definitely will. Now, it's interesting about the pills because initially, and I'd written an article about this, I think, a year or 2 ago, the evidence for the medication was actually not that strong because most of the studies were done with the injectable formulation. They were the ones first done in diabetes. They were the ones first shown in weight loss, and they were the ones who showed the cardiovascular protection. And it's only relatively recently that the studies for the oral medications have come out. Now, when you compare these studies, and it is a little bit apples to oranges because they were done in slightly different contexts, it does suggest that maybe the weight loss and cardiovascular benefits are marginally lower with the oral medications, but roughly comparable. So if you are somebody that does not like needles, and there are many people who are like that, the oral doses do seem to be a viable alternative for, the medical benefit, whether it's diabetes or weight loss or cardiovascular protection.
One of the other things pointed out in this, and again, this is something that's been talked about, but given that it's in the news, worth pointing out again, there are side effects. They have been noted, and they're not insignificant.
No, you're right. And listen, this is true of any medication, right? So there are side effects with these medications. You should not be taking them if you have a history of multiple endocrine neoplasia, Men's syndrome. That's a genetic condition that increases the risk of a specific type of thyroid cancer. So you should definitely look at that. Some suggestion about pancreatitis, although that is a little bit equivocal. There have been situations where it has delayed gastric emptying, so your stomach stays full for longer. That's one of the reasons why you end up eating less, but it also means that it could increase the nausea and the vomiting. It means that you might not absorb certain medications properly, and there have been cases of women taking the birth control pill, it not being absorbed properly, and ended up getting pregnant. This has an issue with people who are being planned for surgery where you have to be on an empty stomach, and usually we tell you, just don't eat the night before, but if your stomach is not emptying properly, well, that can have implications for the general anesthesia, and the most common side effect is the gastrointestinal side effects that start when somebody, starts with the medication on the first time. So there are definitely issues there, which is why it needs to be done in a medical context, and I think the big issue with these medications, especially early on, when people were going to these questionable online clinics where nobody asked you any questions and they just handed you a prescription for a fee, or people getting them illegally. There have been a lot of procedural legal issues with these medications, but if it's being used properly in a medical setting, It is a medication like any other. Yes, there might be side effects. If that happens, you deal with them, and there are ways to deal and minimize the side effects in those contexts.
Now, I'm pretty sure I heard Trudy mention when she was talking about this morning that they brought up gout as one of the possible offshoots here. Have you heard that?
I have not. It's not inconceivable. Whenever you have medications that alter sort of diabetes or electrolytes, and you see this with quite a few cardiac medications, it can potentially increase the levels of uric acid and lead to gout. I haven't seen it. It's not one of the typically talked about side effects. Definitely the nausea, vomiting one's much, much more common. And when people need to stop the medication because of side effects, if you ask them, invariably it's because of the nausea and the vomiting, and that is unfortunate, but it does happen quite a bit.
I wanted just, if we can use this as a segue to the other story that I sent you the note about, which I found really interesting from a doctor's perspective, right? People saying, I'm going to see my doctor, and if you're overweight, the first thing that always comes up is, what are we going to do about your weight, which they don't think is the right approach. They have a different sort of approach here with respect to not even addressing that as the first issue, and also to pointing out that, a BMI, so your body mass index, which kind of was the buzzword for so long, respecting how healthy you were, we shouldn't put all our focus on that anymore.
So that is true. And I think what's interesting about the issue of obesity is something we all do. You just did it without noticing it. I do it sometimes without noticing it, even though I'm very conscious about it. Think about how we speak about other medical problems. We say you have diabetes, you have high blood pressure, you have epilepsy, you have gout. But what do we all say? You are obese. You are overweight. Right. We talk about weight as if it's a characteristic of your person, not a disease that you have. And that is a vagary of the English language. We do it subconsciously. And yet, the way we talk about diseases matters. And so what's really going to be necessary is for us to change our thinking here and think of obesity as a medical problem, just like any other, relevant in certain contexts, but not in others. So if you go to your doctor for an ear infection, it's not really relevant to bring up somebody's weight. But if you're going for a general medical checkup, it is relevant to talk about weight in the same way that you would bring up smoking, the same way that you would screen for mental health, right? So it depends why you're at the doctor. For sure, and this has been an issue with many people who have obesity. This is what happens, right? You go to the doctor and it's the same thing over and over again. I understand why it becomes frustrating. So we as a medical profession need to sort of change our minds and realize that it's appropriate in some contexts, not appropriate in others. And I think what's really going to make the big change is that rather than sort of lecturing people about diet and exercise, which of course, not to say that it doesn't work, but it's like you have nothing to offer somebody. It's like telling somebody, if diet and exercise solved obesity, nobody would be obese, right? So I think now that we have medications, now we can have a much more medical scientific conversation about it. Look, you have this problem, you meet the criteria for it getting prescribed, it's going to be covered by the government. Now we can actually fix the problem, which I think is going to change a lot of how we discuss it, and I hope get rid of a lot of the stigma associated with obesity in the medical system.
So you make the point. Do you sense that there's that willingness to do that in the medical community?
I think we're more aware of it now than we were, say, a generation ago. I mean, one of the things that was interesting about the article, and I didn't realize this until I read it, a lot of older doctors used to weigh patients in their office, and I never do that because if I want to know how much somebody weighs, I will ask them.
Right.
But a retiring doctor said, "Oh, do you want my scale?" Because he was retiring, and I was like, "No. Why would I need your scale?" And I think there has been this generational shift that to weigh patients routinely as part of your general checkup doesn't really do anything. Most people know how much they weigh. Well, roughly speaking. And so that's what you really need to know. You need to have a general sense of whether somebody's above a cutoff to qualify for medical therapy to know how much they weigh. It's usually not relevant in the vast majority of medical circumstances. And so not doing it and not sort of subjecting them to this sort of routine practice is, I think, not something I think the younger generation of doctors routinely do.
Yeah, and to your point, perhaps as a patient, right, if that comes up, you have that ability to say, you know what, no, this is not what I'm here for, and I don't want to talk about this.
Yeah, and hey, listen, it's maybe not. Like if you're going in because you have pneumonia, like what does it matter what your weight is? It doesn't matter. You need antibiotics. If it becomes relevant for dose adjustments, which is not that common, but in rare circumstances it is, then yeah, you ask it. And then you just ask somebody, how much do you weigh? Because more often than not, if somebody tells you I'm about 220, that's usually good enough for whatever math calculations you have to do.
We will leave it at that. Dr. Labos, always appreciate it. Thanks so much.
Introducing Bryan Adams Radio on iHeartRadio. Hosted by Bryan Adams himself.
Join me for an insider look on a wild ride through 40 years of global rock and roll.
Bryan Adams Radio. Now available on the free iHeartRadio app. Or ask your smart speaker to play Bryan Adams Radio on iHeartRadio.
Who's ready to rock?
Kids wanna rock.